Hi everyone, welcome back to my channel. I'm so excited to be back in my studio today doing the third part of what I call the posterior hip and the glute triangle, and we're going to do it in sideline, totally draped without a client's underwear. I think one of the things that really holds up therapists in doing pain relief work in the hip is not knowing how to drape sideline and not knowing what to do once you get there in sideline. So stay tuned, we're gonna get into it today. So let's go right into the draping. So you're going to make sure that there is a pillow under your client's head, and think back into massage school with diaper draping, okay? You're bringing it back. So just a very clean diaper drape diagonally here. And you just move their hand out of the way. And you're going to come up and just do a full diaper drape. Now, if you're dealing with someone you know is very modest, and the only reason you're doing this is because they're in a lot of pain, then you can always have them hold the sheet here and hold the sheet here, and then they're in control as we turn towards the window. And as she turns, you're gonna bring this up and over, and notice that all of the important parts are covered, and you can always add the blanket back. And look what we have access to. Now make sure you have a bolster close by. Go ahead and bring your knee up and over. Perfect, because you still want their hips to be on top of each other. But look what we have. We have access to, we have a drape that's exposing everything from the lateral edge of the sacrum up and over this PSIS and then this ASIS. So look, you've got both triangles that we've been doing. You've got your anterior triangle, ASIS, PSIS, greater trochanter here, and you have your lower triangle, which is ASIS, greater trochanter, ischial tuberosity. So again, I'm not going to go through all this trouble with draping unless I absolutely have a need, and if somebody's in a great deal of excruciating pain with sciatica, zinging down their leg, this is what you're going to do. So I always make sure that this is held here, and then the first thing I ask is, are you comfortable? And then the second you start working, so right now I'm going to work away from her lateral edge of the sacrum. Okay, I want to create space. A lot of times there's a great deal of compression with the low back where it meets the sacrum, and the tension that you feel is right at that lateral edge of the sacrum. So I'm just pushing away and I'm falling with my chest. Notice my leg angle. I'm just using my arms and body as a lever. Just like everything else I do, I don't muscle anything. I use a loose fist. I stack my joints, and you'll notice my leg up on the table, my core is in, and then I just fall with my chest. So I'm just falling here. And then when I need her to come up a little bit more, I'm gonna make sure this tight is held really tight. And then I'm just gonna continue. And I really only need one arm for this, so I really can keep this drape nice and solid. Okay? Again, everything in this upper triangle goes. So I can go that way, I can bring it back, I can come down like this. This is really great to fall away from the posterior iliac crest. And you're really just falling all that tissue, glute minimus, glute medius, they're all right here, and you're pushing away. Notice I'm not using any oil. When somebody's in pain due to sciatica, low back pain, piriformis syndrome, no oil necessary. In fact, you're going to get better fascial results if you don't. Now I'm going to come around the table, and I'm usually going to work this is like your hip flexor area, And I would be remiss if I didn't also work that area as well. So you're gonna push up and away. This is where TFL is. Again, you've got your ASIS. So I'm pushing the tissue away from that ASIS. Remember, I could say this a million times, falling off bony landmarks is treating. And notice everything is covered up. I have access to the IT band. One thing about the IT band that many newer therapists don't understand is that really the issues are here at the knee, and then at the top of that IT band. It's really rare that you have a lot of micro tears through here. So what people end up doing is they push and they push and they push, but then they could be bruising the quadricep muscle, vastus lateralis, that's underneath that IT band. So again, if you're dealing with a runner, an athlete, again, somebody with some pathology, I would work at the end points of that IT band. I would work here, and then I would work here and do a little cross fiber friction. And then if I really thought that there was a hamstring issue or a quadricep issue, I would push away from that bony landmark. I don't like doing this, so I don't do that very often. So I'm going to go back to my open fist. And then in order to stay fresh and not tired, as soon as one tool gets tired, I just switch my tools. And see how I'm always leaning into the table and I'm always falling with my chest. And this is how you do it with a very liberal drape. Now, again, the only reason I would do this is if somebody was really in a great deal of pain. This is the best way to work the hip. So now I'm done with my hip work. I'm going to come back and I'm just going to make sure I hold the sheet, and I'm going to ask the client, could you just come back like you're laying with your back on the table, and see how everything, it's okay if that boulder or if that bolster drops and everything important is covered. And then you're going to undo that diaper drape just like you learned in massage school. No muss, no fuss. And then you can do anything you need. This is a really great time to, maybe bend the knee a little bit, really open up that hip. You can do cross fibe, cross midline. And again, if somebody really needs you to focus on their lower body, this will stand you apart. This will truly help work their hip very thoroughly and comprehensively. And that's what you want. You want to be that therapeutic massage therapist that somebody knows you're going to work their hip so completely. Now, if they need it, if you're dealing with a hip imbalance, then I would do the draping on the other side. If you're dealing with, say, just one area of sciatica, to save time, I might only do that sideline draping in one leg and then do something else to balance it so energetically everything feels great. Well, that's all I have in this series on the posterior hip and sideline and the glute triangles. If you have any questions or comments, please, that helps me out a lot. I want to know if you gained value, or if you didn't, why not? We'll see you on the next video.